appreciate you joining me live on the telecast, ma'am. Thank you very much. All right. Sir joins me live on the broadcast. Sir, as in fact we look at the uptick of the COVID-19 cases, which has been witnessed in the past few days, and this is the first time that it has crossed the 5,000 mark for the active cases. And now when we speak about the kind of measures that we have learned from the previous waves, what should be our first immediate response in handling such cases?
That's an important point that you've raised, that it has crossed the 5,000 mark, and it's important that we take precautions, because it's a JN1 variant, which is a subtype of the Omicron that was responsible for the earlier wave. But this variant seems to be not that virulent, like it's spreading fast, but it is not causing severe symptoms. So most of the symptoms that we are having is like symptoms of common flu, like the patients are having fever, there's cough, there's running nose, there's sometimes sore throat, and sometimes this cough is severe. And occasional patients might have diarrhea and abdominal discomfort also. But there have not been any severe cases as such. But important thing is that we should take precautions, because we all know that this is spreading fast. So we should all wear masks when we are going out, and anyone who is having such symptoms should take precautions, should stay at home, should not go out and spreading the disease. And another thing is that those who are immunocompromised, जिन लोगों को शुगर है, जिन लोगों की हार्ट प्रॉब्लम्स हैं, एल्डरली पेशेंट्स हैं, किडनी पेशेंट्स हैं, these patients they are immunocompromised, and it's important that they take due precautions. They should especially refrain from coming in contact with any infected persons. Try to wear masks when they are going out, especially in public places. And if they have any symptoms like fever or cough, so they should not neglect it, and they should contact the doctor as soon as possible. And anyone who is having severe symptoms, like if he's having breathlessness, if he's having severe weakness, is not able to move about, then certainly that patient should also contact the doctor and take proper treatment from the hospital. Because we know that this is not a very severe form of disease, it's not causing death, but certainly those who are immunocompromised, they should take special precautions. And of course, we all should take the precautions that we used to take earlier of wearing masks and moving about in public places. And not
Mr. Manchanda, as we speak about the measures, it is definitely important and obvious to learn from our previous experience of the earlier waves of COVID-19. But when we speak about the kind of cases that we are witnessing at this point of time, there are reports saying that most cases, as you also have said, are mild and managed at home. While scientists have added that COVID-19 is becoming milder, occasional surges may happen since the virus is now endemic and constantly evolving. They have added that there is no cause for alarm. In such a scenario, all right. Before that, joining me live on the broadcast is my colleague Aditya Kumar as well. As Aditya Kumar joins me live, Aditya, what update are you picking up as far as the kind of cases that presently are being reported from the national capital is concerned? All right, Dr. Sakshi Manchanda continues to be with me live on the broadcast, and as I'm speaking, sir, about the kind of cases which are being reported, and also they are not being considered as severe as it was earlier in the waves. So do you think that there is no need to be in a panic mode at this point of time?
Yeah, there does not need to be any panic, but certainly we need to be cautious. We should not throw down our guards. We should take due precautions. We have to have restraint. we need to take precautions like wearing masks. We should need to wash our hands regularly, sanitize our hands regularly, and any person who is infected should be taken care of. Please, anyone who is having fever should take rest, should take good hydration. Water intake should not be decreased, because dehydration actually causes problems and complications. So water intake should be maintained. Hand hygiene has to be important, and anyone who is infected should stay at home. And it's important that the employers should also they take into consideration that anyone who is having symptoms of fever, cough, cold, sore throat, such patients should be advised rest and should be given leave. And it's not that they continue working at their workplace and spreading the disease. So there is no need to panic. But as I said earlier, we need to take precautions. We need to not low down our guards. We need to take precautions of wearing masks, and especially elderlies, especially immunocompromised patients like kidney patients, heart patients, cancer patients. All such patients, if they are having even the slightest symptoms of fever and cough, should contact their health professionals, should contact their doctors, and take treatment at as early as possible, because in such patients the chances of complications are more. So we need to take precautions, but do not panic. That's the key.
Well, all right. Thank you very much, Dr. Manchanda, for being with us on the broadcast, and in fact also sharing how exactly we need to